Hello guys, welcome back to my channel. Today in this video we'll be talking about atrophic rhinitis. Before talking about atrophic rhinitis, let's talk about chronic rhinitis. Chronic rhinitis, it refers to the chronic non-specific inflammation of the nose. There are various types of chronic rhinitis. Among them are chronic simple rhinitis, hypertrophic rhinitis, atrophic rhinitis, rhinitis sicca and rhinitis caseosa. Now let's talk about atrophic rhinitis. We know that atrophic rhinitis, it is a type of chronic rhinitis in which there is chronic non-specific inflammation of the nose. As the name suggests, there is atrophy of the nasal mucosa and the termidant bones. The nasal cavity in atrophic rhinitis, it appears roomy and is filled with foul-smelling crust. Talking about the triad of the atrophic rhinitis is the atrophy of the nasal mucosa. There is presence of crusting as well as fetor. Normally, there are two types of atrophic rhinitis, that is primary and secondary. In the primary, the exact cause is not known, and the etiology of the primary atrophic rhinitis is various types in which can be remembered with the mnemonics hernias. Atrophic rhinitis, it is a hereditary disease in which more than one members of the same family may be affected. The 67% of the cases are dominant, while 33% of the cases are recessive. Talking about the endocrinal factor, we know that atrophic rhinitis, it is estrogen related, as it occurs more in females as compared to males. It starts at puberty, and the crusting fetor associated with the atrophic rhinitis tends to cease after menopause. Talking about the racial factor, it is mostly seen in yellow and white race as compared to the natives of the equatorial Africa. The atrophic rhinitis, it occurs more in people of low socioeconomic group where there may be a deficiency of the vitamin A, D or the iron. Talking about the infections, the organisms which are seen in the atrophic rhinitis are not the primary causative agent, but these are responsible for the foul smell. And the most common organism found in atrophic rhinitis is the Klebsiella ozyna, which is also known as Perry's bacillus. The other organisms which may be found in the atrophic rhinitis are the diphtheroids, Proteus vulgaris, E. coli, Streptococcus and Staphylococcus. Atrophic rhinitis, in atrophic rhinitis, there is also involvement of the autoimmune involvement, as there is destructive process by the body against the antigen released from the nasal mucosa. The viral infection or other unspecified antigens may trigger the antigenicity of the nasal mucosa. The autonomic imbalance may also be responsible for atrophic rhinitis, along with the involvement of the surfactant deficiency in the nasal secretion. The atrophic rhinitis may also be developmental, where there is congenitally specious nasal cavity or there is poor pneumatization of the maxillary antrum. Talking about the pathology, we know that normally the nasal mucosa is lined by ciliated columnar epithelium, but in atrophic rhinitis it is replaced by stratified squamous epithelium. There is also atrophy of the seromucinous gland, nerve elements, venous blood, sinusoids. The arteries in the mucosa, periosteum and the bone show obliterative and arteritis. The bones of the nasal cavity, that is the turbinates, they undergo resorptions, due to which there is widening of the nasal cavity. The paranasal sinus are small due to their arrested development. There are two types of atrophic rhinitis, type 1 and type 2. In type 1, it is benefited by estrogen therapy, as there is endarteritis, periarteritis of the terminal arterioles, which are benefited by the estrogen therapy. But in type 2, there are already presence of the dilated capillaries, which are worsened by estrogen therapy, as estrogen also causes the dilatation. Talking about the clinical features, we know that the patients, they mostly present with the features of nasal obstruction, epistaxis, merciful anosmia and the greenish yellowish nasal discharge. The nasal obstruction is due to the fact that the nasal cavity, even though it is widened, it is filled with the crust, due to which there is presence of nasal obstruction. And epistaxis, it occurs when there is attempt of removal of the crust. And here the anosmia is typical, that is, there is merciful anosmia, as the foul smell from the nose, it makes the patient a social outcast, even though the patient himself is unaware of the smell due to marked anosmia. And there is also presence of the greenish yellowish nasal discharge. On examination of the nasal cavity, we can find that the nasal cavity is full of greenish or grayish black colored dry crust, which covers the nasal septum as well as the turbinate. On removal of the nasal cavity, there occurs bleeding. After the nasal cavity is removed of the crust, and we can see that the nasal cavity is roomy and there is atrophy of the turbinate, so much that the posterior wall of the nasopharynx may be seen. The mucosa here is pale and there may be presence of septal perforation, dermatitis of the nasal vestibule, or there may be saddle deformity. The atrophic changes along with in the nose, the atrophic changes may also be seen in the pharynx and the larynx, which is known as atrophic pharyngitis and atrophic laryngitis. In atrophic pharyngitis, in the pharynx it appears dry and glazed with crust. In the larynx, it is characterized by hoarseness of the voice along with presence of cough. And if there is obstruction of the Eustachian tube, it results in hearing impairment and there is middle ear effusion. The paranasal sinus are small, underdeveloped with thick wall, and on X-ray it appears opaque. The antral wash is difficult to perform due to the thick wall of the sinuses. Now, talking about the causes, we in this video will be talking about the causes of the anosmia, nasal obstruction. The causes of the anosmia is that there is loss of olfactory neural elements. The thick secretions and crust are over the olfactory area, and due to degeneration of the secretory glands, there is scanty secretion for dissolving the odoriferous materials. And the causes of the nasal obstruction, even though there is ruminasal cavity, is that there is blunting of the sensory nerve endings, there is crust formation, and there is lack of eddy current formation in the nasal cavity. Now, causes of the nasal obstruction, even though there is ruminasal cavity, as in atrophic rhinitis, is due to the fact there is destruction of the nasal cycle and there is crust as well as there is discharge.